subcutaneous fluids include electrolytes. Now, it depends on the fluids that we're using. There's a variety of them, but there's also a variety of electrolytes. Some of them have more sodium and chloride, some of them have potassium, some of them we add potassium to. There's a very long list of fluids that we use.
If you're new here, welcome. I'm Dr. Emily, and this channel is dedicated to helping you take the best care of your senior kitty. Make sure to hit that subscribe button so that you don't miss a thing, and like and share the video so I can create more content like it.
And there really isn't a perfect fluid for all situations. That's why there's a variety of fluids that we use for subQ therapy. It depends on the disease we're treating, it depends on the animal we're treating, it depends on what their blood values look like. Probably the closest thing that's been created to the perfect fluid is something called Normasol, and you can hear it in the name, normal is what they're going after. But there really isn't that perfect fluid for all situations. But she is correct. subQ fluids do have electrolytes in them. So the question was, if you choose to use oral fluid, or basically water, to increase hydration in your cat with kidney disease, how do you address the electrolytes? And the great news there is you don't really have to. Water is the absolute perfect solution to the situation, aside from the fact that most of our cats don't want to drink enough of it to account for the disease process that is chronic kidney disease. So when we get to the point of using subcutaneous fluids or fluids under the skin with cats with kidney disease, it's generally because they are unwilling to drink enough water to meet what is being flushed out through their kidneys into their bladder and into their urine. And because of this flushing process, unfortunately, a lot of the electrolytes go with it. But if they are drinking normal water, they are generally balancing those electrolytes themselves. So if you choose to just increase your cat's water consumption, they are on board with that, obviously, then we don't really have to worry about the electrolyte game unless our blood values say something else. And the second part of this question leads into that, in that potassium in chronic kidney disease cats, the range for that is different than the ideal range for that is different than what you will see as the normal per se on the lab values. And I always go by the International Renal Interest Society's recommended values for these things. So her question is, if potassium isn't necessarily accurate on blood work according to those reference ranges, what do we do with the rest of the electrolytes? And really, the two big ones that are problems here are potassium, because potassium is something that comes and goes from the bloodstream. So depending on the stage of kidney disease, sometimes our potassium creeps high, sometimes our potassium creeps low. But the blood value on potassium, so when we draw blood, run that through a machine and look at what the potassium level is, isn't 100% accurate, because potassium may be in the bloodstream, but more often than not, it's in the cells, it's in the muscles, it's doing the bodily jobs. So if the blood value on potassium is low, it doesn't always mean that the value is low in the body, because our potassium may be in the cells instead of the blood that we drew. Now, because we have that disease process in chronic kidney disease where we know they tend to lose a lot of potassium in the urine, it's generally safe to say we're going to supplement this if it's on the low end of this reference range, because it can cause muscle weakness and a lot of other complications. Calcium is another example where calcium, as you can imagine, tends to live in the bones. It doesn't always live in the bloodstream. We're generally worried about a high calcium level, but because it can jump in and out of the bones and bloodstream, we don't necessarily know what that value is. So when we want to know specifically what that value is, we run what's called an ionized calcium level. That's a much more blood accurate number. And if that ionized calcium is high, then we get concerned. It doesn't usually apply to things like sodium and chloride and a lot of the other electrolytes. It depends on, again, the patient we're treating, the disease we're dealing with. So when it comes to kidney disease, potassium and calcium are probably the two big ones that we look at. Phosphorus is pretty accurate in the blood work, although now we've got the FGF 23 value that gives us a little bit more information. So when it comes right down to it, if your cat will drink enough water on its own to maintain its hydration. That is the gold standard. Now we are dealing with cats who don't like to do what they are told, and we are dealing with cats that don't like to follow the rules. And in this particular group, we are not dealing with healthy cats. So we cannot apply all of the normal healthy rules to our cats who have chronic kidney disease, but that's kind of the big general picture.